Hi everyone, my name is Dena and I'm from China Medical University of Taiwan. My talk today is about the design of bioethical cases spanning over general and professional education. Most of the time now I work in the Center for Public Development. Where's the one? So, as a faculty in the medical university, I've been always thinking about the role of teacher, especially in bioethic education. And then I just realized it should be an agent to promote learning, simply let learn and rather than teach. It can also be said that teacher should be moved from traditional teacher-centered didactic lecture into student-centered participant-led learning. And my way to involve students in participatory learning is a living cases that I have to provide to guide in awareness and to identify ethical issues. And then I will emphasize that the research responsibility of students to equip foundations of life science, philosophical, and social and legal knowledge. And then I will offer environment for them to have discussion and analysis to involve or to practice ethical reasoning, that is thinking skill. And then I can expect that students have reflection and internalization to become ethical maturity. That means they will have increased their moral sensitivity and ethical sensibility. I read Chinese in there. So I think this is different. For ethical sensibility is my overall goal. And finally, we might expect that students know how to make decisions and doing the right thing because it is right. So, a qualified trigger cases is very important. It's where stimulate students to have interaction, learning, and also have critical thinking, to practice their critical thinking. So the qualified cases should be a living cases, will include those kind of things. And overall, it should be interesting, attractive, clear, and realistic. It's a sequence in learning ethics in medical university. First is general ethics, and then we come to professional ethics, and then finally clinical ethics. So it should be from general to professional and to practical. So the design of 3-level ethics course in our university is, for the general education was in the first and second year, that we have a course called Lab and Ethics. And then for the second level is professional course. We do it in the 4th year of medical school. So it is biomedical ethics. And then clinical course in 5 years, the 5th years, we call it clinical ethics. So this is a sequence. And the graduation learning objective will be like this. For lab and ethics, I would like to enable students to respect life, consider benefit versus risk, and then understand better in diversity. And for the biomedical ethics, I would expect students can be able to develop ability in ethical reasoning, and then they realize the values in medical professional reasoning. And for the clinical ethics, we would like to able students to improve ethical sensibility in clinical work, and they will bring ethical consideration to clinical practice. So for the level 1, lab and ethics, we have those objectives. Then we need several trigger cases like this: animal welfare, genetic modified food, artificial reproduction, embryonic stem cell experiment, organ donation, genetic privacy, and gene baby. So I give you the name of the case. For example, animal welfare, I give a story like, what are those animals for anyway? And I have to give a title that students will feel interesting. So for the GM food, we give the title that, does the supposedly cheaper and better GM food make you uneasy? And for gene baby, a title like, for disease avoidance or life enhancement. And for stem cell experiments, I give the title, a story titling, Will the Paralyzed Superman Rise Again? And for the organ donation issues, there's a story, a title, I will do whatever it takes to keep my daughter live on. And for the issue of genetic tests and privacy, there's a story titled, I do have right to not to know, don't I? And this year I give a new story, artificial reproduction, that we talked about that yesterday. Save my egg, I decide my future. It's for new modern generation women's world. So you will see we have respect life, we have benefit versus risk, and we have diversity of this kind of objective in those stories. I'll give you an example. It's I do have the right not to know, don't I? It's the subject of genetic privacy. And this is brief story. I just make it brief, very brief. Original doesn't like this. It's a story talking about a man is susceptible to inherit a genetic disease of SCA. And it's a late onset disorder. His wife from foreign country got to know the situation from the family's history just after they got married. To decide having children or not, the wife insists that her husband to have a predictive test. But the husband refused. He said, I would rather die if I know the result is positive, because it's a late onset disorder, he doesn't know in this moment. However, a positive result of gene test of fetus had disclosed that he had inherited the disease. So in this case, students have a lot of discussion. I show you the theoretic guide question is, first, benefit and risk of testing at-risk adult. And also, they talk about right and obligation of a man with genetic defect, and the genetic consultation, genetic screening in the hospital, and issues of terminate fetus, technique of PGD. And also, they talk about the genetic discrimination. Then you will see all the objectives: consider risk and the benefit, respect life, better in diversity, are all in this case and all this learning content. And the other result is relative subject of debate, is decided by the student. They spend a lot of time talking about, for example, gender equality, right? How the right of the wife to marry a defect genetic man, and domestic issues on foreign spot is a local issue in Taiwan nowadays. And also the life value, life education, and they are very interesting about abortion. It's its right to abort the baby. And So you will see, I'm sure that my objective is after this case study, then this case discussion that can be achieved. So for the second level, biomedical ethics, I just give the aim, cultivate the ability of moral reasoning and to realize value in medical profession. I have all those trigger cases, and I show you the next slide. For example, truth-telling about terminal cancer is a story with the title of "To Tell or Not to Tell Her, What is Dilemma?" And the second issue is the right and duty of a doctor. We talk about the doctor with acts. And then patient self-determination. A story like, can patient's autonomy become an issue of life and death? We're talking about people with blood infusion. And then there's a case, medical malpractice and error disclosure. I shouldn't speak out. This is the title. And then natural death and euthanasia is very popular issues in this level. And the sweet death of Pope John Paul II. So you know, so you know the story already. So it is very important to differentiate natural death and euthanasia. So for example, truth-telling about terminal cancer, this is a story, a brief story. I don't think we should read it, but we can see the content of the discussion. First, our student will think about the emotion to face death. How can people face death? They realize the truth. And the life and death, suicide issues also. Can it be a big shock will cause suicides? And then dying awareness related to cultural effect. And pro and con of telling the truth for a doctor, for the medical system to tell the truth. And the communication skill and empathy, how to show your empathy while you tell the truth. And right of patient to be informed. This is come to moral reasoning. And doctor's legal duty of disclosure. And the life quality, end of life issue, and the palliative care and hospice. Those are all in their discussion. So it is from general to professional. You see, in one case, it could be from general discussion, general issue, and then to more and more professional issues. And there's another subject, nature, death, and euthanasia, because this is so important that we put it in the second level. So this is story, you know that the Pope John Paul II, they suffer from Parkinson's disease in his late year. And the people questioned that before his death, an attempt was made to hasten the death by removing the feeding tube. And finally, the church clarified that when death is inevitable, it is acceptable to terminate treatment accepting the natural death. Let's withdraw all the high-tech medicine, including the feeding tube. So the result of students is the issue to discuss natural death and euthanasia. They spend quite a lot of time talking about the law and the ethic and to differentiate these are different. And they're also talking about the withdrawal of life-sustaining treatment. Who should do that? And who the duty to do that? Or the right to refuse of a medical health profession. And they talk about artificial nutrition and hydration for end-of-life patient. And end-of-life decision, whose decision? How could we know it's patient's decision? And the life sense, sanctity, and the life quality. So those discussion content, I would say, is moral reasoning and the professional value insight. And for the level 3 clinical ethics, we give a simple aim to bring ethical consideration to their clinical learning. So we give problem-based cases. Narrative of end-of-life issues in ICU is a case story, a very narrative case story. And I also have another case, is ethic consultation for late dementia suffering. This is used for IPL, interprofessional learning. For the narrative story, the narrative of end-of-life issue in ICU, we talk about the 65 years old man. He was, in the beginning, it's a severe respiratory tract infection, and then developed into ARDS, and then was put under a respirator and heavy sedation, and never be able to wake up. And despite of the effort in ICU, he's expired. After 42 torture days, is a long time in ICU. The family signed DNR finally, and the request and impending death discharge. That's in Taiwan's culture. People would like to die at home, as customary. And family felt regret for patients' prolonged suffering before death. So I just called patients' work because we really did the interview, a very in-depth interview. Family's narrative is there to show students what patient feel. Even you have made effort and try to rescue his life, but finally the patient said wasn't able to live us anymore. That's, for example, they say the doctor never responded to our practical needs. How much we needed our father to wake up and say something. Anyway, he was not rescued and wasn't able to live us anymore. This is important for patient. And then they talk about, the family talk about, when he was admitted to the hospital, we never thought that he would not be able to return home. So it's an emergency, it's not terminal state for a long time. But anyway, we signed the DNR like the doctor's request. They say it's doctor's request. And the only thing we had hoped was that he would hang on until he arrived home. I resent that the hospital couldn't help us manage it. So after reading this narrative, the students have a sequence of response. I mean the senior student, they're working in the clinical already. First, they say empathetic understanding of the family's narrative. This is really true. From the very beginning, they resist to patients' families' the work, and then they try to empathy, and then they turn to empathy, have empathy. And second, self-reflection over previous action in medical care. They are thinking about what they have always done. And then they have motivation to do good for end-of-life patient and their family. So I think it's very important because the results, the patient, the student talk about how to doing good in caring the end-of-life patient and family. Inform the truth telling, how to inform. It's good, it's doing good for the family. And how to inform the truth, and how to spread their empathy, and how to maintain patient's terminal appearance, even patient couldn't be cured. And in these cases, we just remind students have to talk about good intent behind DNR. Not because the doctor requests patient to sign DNR. The DNR behind, they have a very good intent. And the family's need for the dying situation, and also to realize the custom and ritual of dying in Taiwan's society. So I would say that the three aspects of learning bioethics can be done by this case discussion. For example, population significant to society is very important for medical students. And second, behavior relevant to humanity is also important. It's the key core aim of our medical education. And finally, life science knowledge. The medical student, they won't forget it. So also, I checked the competence can get from case discussion, something like team spirit, communication, self-directed, critical thinking, and professionalism, and lifelong learning. So this is the aim of both general and professional education. So for my conclusion, first, to create effective cases for bioethics learning, the scenario should lift students to achieve diverse learning objectives. Ethical preference should not only be appropriate to the level of students' understanding, but also, very important, need to infuse sufficient intrinsic interest for students. Then they have motivation to learn. And in general, case consists of ethical inquiries. It's derived from dilemma occurring in everyday life. Then involve into more specific issues relevant to the context in professional practice. Thank you very much. We still have a long way to go.
Thank you, Dena. Questions, Joffrey, please. Professor Takahashi first.
Dena, thanks for the nice presentation. As a teacher, I would like to share something with you, and finally I'll be asking you a question. Around 2000, I came into contact with Mesa, Dr. Daryl, and somehow I have plunged into bioethics. So from that time onwards, my teaching of physics changed to some extent. Normally, when students ask some questions, so I will say, no, this is not the correct answer. But after coming into the bioethics arena, I will say, you have come closer, you have come closer. Okay, try like that. So my attitude towards my students have changed, and moreover, I do not know if it is Daryl's intervention that my principal gave me an additional assignment of looking after the Department of Religion and Value Education. So Daryl was coming to college very often to address the bioethics education. So from that day onwards, after he is coming frequent to college, then I thought the students are expecting more from me. So yeah, the principal also has given me an additional load to look after the value education as a value education. So now if we teach bioethics or values, then I think the teacher's attitude, or the teacher should be a role model than the other teachers. What do you think of that?
Thank you for your question. Yes, I think this is special for the medical student. You know, in their situation, they are very busy in studying many things. They are not philosophy. They are not studying philosophy, and they like to know how to use ethics as a practical thing in their future career. And the second thing is that nowadays we just encourage students to learn, to have active learning. We are not on suggest as a one-way passive way. So they have all the internet information, and I just give them information. How can you get the relevant information that you should know that. And I think that they feel comfortable with that instead of sitting there and listen to you. And sometimes they will ask my answer, and they look forward to my answer. But I try very hard not to give their answer, because there is not only one answer. Usually, I don't want the authority way to show them what is the right, what is the wrong. They have to realize themselves, and they are very high expert in the future. So they have to decide themselves. They shouldn't be follow others. So that's my philosophy, especially in the medical university. But I think in the other field, maybe you have to spend more time in guide them, to show them. As a philosopher, you have to speak out. And but in the medical school, is the other thing. Yeah. Thank you.
Thank you. Professor Takahashi.
Thank you for the presentation. So your method is make student think about the bioethical issues by themselves and make their own judgment. Is it true?
Well, we have guide. We have guidebook. Yeah.
A guidebook.
Yeah, we have. Yeah. For every case is not only story. So finally, we have. If they have tutor, I'll give them the tutor guide, and they know what is my design. And
I see.
So it's not just let them learn. It's active learning, not only self-learning.
Maybe in that guidebook, there are some guidelines, government guidelines or relevant laws.
Yeah.
So if the judgment, student judgment conflict with guidelines or relevant laws, how do you teach them?
Yeah, they will find the answer, but they have search responsibility, and they will debate, and they will interact, and if they will always somehow find the answer. I never found the students still feel very wondering. But for us, the case discussion, the very important is exploration. It's not problem solving. Problem exploration is more important than problem solving. Because problem solving, you have to have, depends the situation ethic. But the problem solving, problem exploration is always need. You always need problem exploration, and then when you face the real dilemma, then you know how to consider it, every aspect. That's my purpose. Yeah.
But in the clinic situation, if they violate the guidelines, they will be punished.
Oh, it's about law, right?
Yes.
Yeah, because you are against law, you will be punished. Yeah, something like euthanasia, and they talk about law.
Yes.
And they realize that in Taiwan it's totally not allowed, the euthanasia. But for the nature there, you have to follow the way. It's not only, first of all, you have to have two doctors to decide is this terminal state. Then you can go to have a natural law. So is that your question?
Yes. Then one way to follow the guideline and to think about bioethical issues by themselves. Both are necessary for me.
Yeah, they will search the law, not me give them the law to show them the law. They will search. The internet was very convenient for them. They are so quick to get all the information themselves. And if they don't, they will go back to search and then come back to the team again.
All right. I only want to raise a last question. Okay.
Yeah.
I appreciate your design of the whole cross and very good. I would like to invite you sometime to my university to give some talks. Okay. But here I would like to raise a question about you. your whole design seems to teach students how to analyze problems. Okay. I wonder whether you have any theory of about ethical education behind that.
Yeah, we have some.
And what are the goals you want to achieve? Except is it just a kind of intellectual training? And how about?
And nowadays, we still have some lecture course, but very minimal. Like I have only 6 hours for the medical students. The 6 hours is talking about the principle, theoretical, and then for topic analysis. That's all. So I give them have 2, and then they will learn themselves. Yeah.
I mean, you may have some kind of practical implication throughout the courses, and maybe have some influence about their characters, and may lead them to put into the practice. But you are not talking anything about that.
Yeah, we're talking about in 6 hours lecture. I think that's quite enough for them. Yeah, they are not empty bottle. Yeah, you don't have to fear from the beginning because they learn from the other course like philosophy course and some other course. And we don't have to teach them from the beginning. They are adult and they are very smart students.
I'm not saying that you teach them, but it's behind the design of your course. Then you must have some kind of theory about.
Yeah, in the
whatever.
first class, I will explain to them why my design this way. In the first class, yeah. In the first hours, I will. And at the moment, it's only a hybrid. It's not totally discussion. It's a hybrid. But I try to limit the time out lecture. For the lecture, I show my enthusiasm in bioethics. I think it's very important. I show them they have some principle, they have some theoretical background. It's not only your intuition, it's have some knowledge background. And that's it, to let them know what is bioethics. And for the cases, I shouldn't tell them what should do, what shouldn't do. And they will find out the relevant information and they decide one day I will do. Something like they'll reflect. I feel very touched. They say, as a doctor in the future, I know it's very important to communicate, have communication skill. I'm not only cure patient. I have to interact with patient. And otherwise, if I tell the truth and the patient couldn't stand the truth. And all kind of things like that.
Daphne?
Yeah.
Dena, I was so touched the way you presented this beautiful presentation. I noticed, just one comment, I noticed that you have bypassed the whole principlist approach. I don't see any principles coming in here. So it's a personal approach, personalism, which I feel is very good for the students. Question I wanted to ask you was, you are in a nursing school also. Do you ever have medical students and nursing students together and have joint classes so that the same approach is taken by all? And what would be the difference between these two groups?
Yeah, I tried many years, and this year we just stopped it because some other reason. Before we try and put in the big class, and I put in the small group, 5 medical students, 5 nursing students in the group. And you have to solve many problems at the time schedule. And also my nurse students feel unsatisfied that because in the big lecture class, the medical student behave so bad. They are not concentrated and listening to the philosophical talk. And the nurse student, they would like to because they are very, they just follow the rules and they respect the teacher so much better than medical student. But, and I also put it in a group. For the principle, we talk in the big class. I think for them it's not difficult. It's very easy to understand for principle. And also theoretical to theory like utilitarian and deontology. We use a very superficial talk, that's all. If they are interested, I offer them some article to read. And I don't talk that in the class too much. I just show them a case to talk what about utilitarian and what is theoretical. But they have some other class, philosophy class. I'm not a philosopher, and I watch very much to let students know ethics is practical. You will need that very soon. It's not so far away from you. So I make it more practical.
Nathan?
Just as you said, the teacher has to moderate the debate and usually not to actually make a final judgment. If you do that, it causes the suppression of participation of the students in the debate. So I read about this. I think I put it in one of my presentations, and I experienced it. When students realize that you are going to finally answer, that will suppress actually their participation and their critical thinking about the issue, and so they will learn less. So I completely agree with your attitude not to intervene in their debates.
You see, it's never ended. Even they finish their discussion, they still talk about that all the way they're back to home. Because the ethical issue is not easy to have a definite answer. And we have a gather together in the final. I just use 20 minutes. I challenge them if they present what the group's consensus about these issues, or they have something, and I challenge them to let them have the in-depth thinking. If they are very superficial or they just ignore some other aspect, I just challenge them. But I don't do that in the class that we got everything, and I will leave them to think about it in the few hours. And when I get to their reflection, they have to do their homework. And I found it's better, much better during the group, because when they go back, they think about that and they search for the information. And then, so I let them choose. If you have 4 topics, you can only hand out 2 homework, 2 of the issues. And they will pick up which one they feel very much and then try to survey more information about these issues. So it's very, I don't know if you can understand that in medical university, students are always very busy. They have all kinds of learning and they are very heavy in study. So I had to try the way to let them understand what is bioethics. I just try very hard not to let them feel this is a burden and this is useless things and this is a very high morals thinking. That's all.